really, for the three of us, a privilege to join you today because this is a really important session. We're going to talk about the global patient safety challenges and WHO's response. And I really want to thank the organizers for inviting us to participate and for having an agenda item on this topic during the meeting. Just to introduce a little bit where we're coming from for this topic. Of course, we all know that the saying of first, do no harm. And I think we all agree that this is the most fundamental principle of any healthcare service. First, do no harm. Because nobody should be harmed when seeking healthcare. It's kind of an obvious statement. But despite this age-old statement and age-old intention, what we see is that there is quite a lot of evidence that there is a huge burden of avoidable patient harm across the world, both in developing and in developed countries. And if we try to put some numbers on that, then we see that roughly 1 in 10 patients, which is an enormous number, are harmed due to unsafe healthcare. And more than half of those is actually harm that is preventable. Almost half of all the harm is attributed to medications and invasive clinical procedures, surgical procedures, healthcare infections and diagnosis are other main causes of harm due to unsafe healthcare. And as I mentioned already, it is a global problem. It is both in developed and in developing and in industrialized countries a problem, but as you can be expected, it is worse in low and middle income countries. And in these countries, unsafe healthcare contributes to around 2.6 million deaths every year. So against that background, WHO has launched in 2005 a series of global patient safety challenges to drive global efforts in addressing the main causes that are behind these patient safety issues. And these challenges, they cover areas such as hand hygiene, safe surgery, medication safety, and so on. And clearly, these challenges, these problems that we're facing with patient safety are so important that they clearly require some additional discussions. And that is what this session is about. And that's why I'm very pleased to introduce my two colleagues. They already were mentioned earlier. First, my colleague from WHO Geneva, Dr. Neelam Dhingra, who is the unit head of the Patient Safety Flagship in the Integrated Health Services Department. And I'm also very pleased to introduce Professor Tan Kok Hian, who is the Group Director and Senior Associate Dean of the Duke and the National University of Singapore Medical School in Singapore. Dr. Neelam Dhingra will first give an overview of the global patient safety challenges and WHO's response. And then Professor Kok Hian Tan will speak about Singapore's experience in taking forward the Global Patient Action Plan 2021-2030. And after these two presentations, we will have a Q&A, question and answer session, where you can ask any questions you may have, and the two speakers will be very happy to address those. So without any further ado, I would now like to give the floor to Dr. Neelam for her talk around the global patient safety challenges and WHO's response. Dr. Neelam, over to you.
Thank you so much, Dr. Vandelae. It is such a pleasure for me to join today, and I would like to thank the organizers for giving this opportunity to WHO to share our patient safety journey over the last couple of years. And I would actually like to reiterate some of the key figures which you mentioned about the risk of avoidable harm. First, to know harm is the most fundamental principle of provision of healthcare in any healthcare system around the world. When we go to a healthcare system, we never expect to be harmed. However, there's a huge burden of harm due to unsafe care globally. It's one of the leading causes of death and disability, and up to 3 million deaths occur annually due to unsafe care globally. And 1 in 10 patients are harmed in healthcare. And up to 50% of this harm is preventable. In low and middle income countries, 4 in 10 patients die due to unsafe care. It's a huge burden, which is due to unsafe practices as well as due to adverse events. While countries are on their journey for universal health coverage and we are expanding access and more primary and ambulatory care services are being provided, there's a huge burden of harm even in primary and ambulatory care. 4 in 10 patients are harmed in settings in primary care and ambulatory care, and up to 80% of this harm can be avoided. Medication safety is also a major issue. 1 in 20 patients experience medication-related harm, and it harms actually millions of patients around the world. 20% of this harm is severe and potentially life-threatening. There's a huge economic cost of unsafe care as well. High cost and there's very high expenditure in treating safety failures. In OECD countries, 50% of total hospital expenditure and activity is due to the direct result of managing these safety failures due to adverse events. Member states around the world and political leaders from many countries around the world have taken leadership to highlight the issues of patient safety at the global level. And a landmark resolution on global action on patient safety was adopted at the World Health Assembly in 2019. World Health Assembly also recognized patient safety as a global health priority and established an annual World Patient Safety Day to be observed every year on 17 September as part of this resolution. The Assembly also asked WHO to formulate a global patient safety action plan from 2021 to 2030, aligned with the Sustainable Development Goals, as a roadmap for next 10 years of action. WHO has launched a decade of patient safety as part of its response to this global call for action on patient safety. And this decade of patient safety has several key streams of work. Some of these are, you can see as part of this slide, working with countries and partners to develop a global campaign for World Patient Safety Day and facilitating the message as well as public and patient engagement around the world based on an annual theme related to patient safety. Working with partners and countries to develop development and implementation of the Global Patient Safety Action Plan, the Global Patient Safety Challenge on Medication Without Harm, Global Patient Safety Collaborative, in which we work with several countries around the world for direct support and cooperation, and the Global Patient Safety Network, which provides a platform for interactive exchange of information, challenges, and solutions by different stakeholders around the world. Development of patient safety standards, guidelines, and tools as one of the key functions of WHO. And finally, as part of the Global Action on Patient Safety and a decade of patient safety stream of work is patient and family engagement to enhance the engagement of patients in their own care, as well as provide guidance and support to the healthcare systems in developing safer and resilient health systems. The Global Patient Safety Action Plan, as part of this resolution and action, was developed over a period of 2 years from 2019 to 2021 and was adopted by the World Health Assembly in May 21. And this Global Patient Safety Action Plan, as I mentioned, is a roadmap for concrete action by different stakeholders on patient safety. and it's based on 7 strategic objectives. And then each of these strategic objectives have 5 corresponding strategies. So policies for zero patient harm, high reliability systems which look into application of human factors and have safety culture and leadership embedded in its day-to-day operations, safety of every clinical process, every interaction which happens between a healthcare worker and a patient and the entire healthcare system when it interacts with patients who access the healthcare. Patient family engagement, health worker education skills and safety, information research and risk management, and finally, synergy, partnership, and solidarity. And as I mentioned, against all of these 7 strategic objectives, there are 5 concrete strategies, provided a framework for action in a 7x5 matrix, which is truly a systems approach to addressing patient safety and reducing avoidable harm in healthcare. Several categories of stakeholders have been identified for implementation of the action plan, particularly government and government agencies, healthcare facilities and services, key partners, patient organizations, professional bodies, academic institutions and research institutions, and also WHO through its 3 levels of the organization. WHO launched its first survey to assess the progress in implementation of the Global Patient Safety Action Plan in 2022. And last year, in May 23, for the first time, we reported to the World Health Assembly. And we have a mandate to report to the World Health Assembly every 2 years till 2031. And if we consider this first set of responses which we receive from countries as the baseline of where we are globally in patient safety, you can see that data from 108 countries have shown that we are a long way to achieve elimination of avoidable harm in healthcare and improving patient safety significantly and significantly reducing harm in healthcare. So a couple of statistics which I want to share with you is that 27% countries reported they have developed a national patient safety action plan and equivalent. And when we look at where we are in terms of patient engagement and patients contributing and guiding the development of safer and resilient health systems, only 13% of countries have a patient representative on the governing board in 60% of more hospitals. So what you see on your screen are 10 core indicators. And I would not go into details of all these figures, but if we consider our target of 100%, you can see in many of these indicators related to publishing an annual report or developing a system of never reverse reporting or having patient safety curriculum implemented or having national targets for healthcare associated infections or medication related harm, implementation of patient safety charter for health worker safety, and also establishing a national patient safety network, as well as having a reporting and learning systems. In all these, we are still a long way to go, but I'm very confident that over the years, we will see significant progress when we reach out to countries. We are working together with partners and countries to implement the Global Patient Safety Action Plan. And I'm confident that every 2 years, we will see improvement in patient safety through these efforts. Now look at the global advocacy, which has been going on for a couple of years, and how it has transformed action globally. The political leaders from countries started an annual series of ministerial summits on patient safety, starting from 2016. And the very first summit was organized in UK, hosted by the UK government in London. And then it was followed by a second ministerial summit, which was organized in Bonn in 2017, hosted by the German government. In 2018, a summit in Tokyo, hosted by the Japanese government. And in 2019, a summit hosted by the Saudi Arabia government. It was organized in Jeddah in 2019. And these 4 summits to begin with provided a huge global advocacy, which led to the World Health Assembly resolution and the establishment of World Patient Safety Day in 2019. And since then, there have been ministerial summits ongoing to keep the momentum on patient safety. In 2023, I must say that it was after 4 years due to COVID, Swiss government organized an extremely important summit, engaging political leaders from around the world. And this summit led to a Montreux Declaration on Patient Safety. And this year, in just a month, more than a month time, on 18th of April, the 6th Global Ministerial Summit is being organized by the government of Chile in Santiago. So I just wanted to share this global patient safety movement, which has been created by the ministries of health around the world, which has led to this major advocacy and action. And aligned with these years of establishment of World Patient Safety Day, every year there has been a theme for World Patient Safety Day, which has provided a global platform for countries to prioritize that area of work. So in 2020, it was and the issues related to health worker safety were identified as a major challenge. And the 2020 World Patient Safety Day was dedicated to health worker safety, a priority for patient safety, with the slogan, Safe Health Workers, Safe Patients. And both in 2019 and 2020, we had given a call for action and slogans to the world, Speaker for Patient Safety and Speaker for Health Worker Safety. Building on to these 2 years of celebration of World Patient Safety Day, in 2021, maternity safety was identified as a theme, and Act Now for Safe and Respectful Childbirth was a slogan which provided an extremely successful global campaign. In 2022, Medication Without Harm was a theme of World Patient Safety Day, with No Check Ask as a major campaign of engagement of patients and health workers during medication therapy. In 2023, engaging patients for patient safety was identified as a theme for World Patient Safety Day. Elevating the voice of patient was the important slogan, which again provided a huge opportunity for partners and patient organizations and patients to prioritize patient safety, understand what is patient safety, and also implement the actions which are required by patients and patient organizations in particular, and also political leaders and healthcare workers for engaging patients for patient safety. This year, the theme for World Patient Safety Day is diagnostic safety. And the slogan we are giving is make it right and make it safer. So building on to these, to the campaign of 2023, elevating the voice of patients, WHO has been asking for several years countries to illuminate and light up important monuments in orange color. And you can see year after year, iconic buildings and monuments and offices are lit up in orange color, providing a huge opportunity for global solidarity. For 2023, WHO leadership was fully engaged in this journey for engaging patients for patient safety. A global conference was organized as part of WHO response. And this was the first time actually where we had a hybrid and in-person meeting after 4 years due to COVID. And it provided a huge impetus and visibility to issues of patient safety and the role patients and families play in patient safety. Coming to one of the global patient safety challenge on medication safety, WHO has given these global patient safety challenges as change management initiatives. And there have been 3 challenges given to the member states and to the governments around the world on patient safety. The first one was in 2004 on Clean Care is Safe Care, which led to hand hygiene guidelines. And in 2008, actually, it was Safe Surgery Saves Lives. In 2017, actually, to be precise, the third challenge on medication safety was launched. And WHO has developed several resources to support member states and partners to implement the challenge. And you can see on the screen a strategic framework which has been provided to take action on medication safety and reduce medication-related harm in the areas of patients and the public, healthcare professionals, medicines as products, and systems and practice of medication. And under these 4 domains, there are 4 subdomains each, which identify areas where interventions can significantly reduce harm due to unsafe medication practices and medication errors. WHO has developed guidelines and technical reports. You can see high-risk situations, transitions of care, polypharmacy, as well as 5 moments for medication safety, and a campaign for no check ask, among many other resources which have been developed. Recently, we launched 3 more publications related to medication safety in lookalike, sound-alike medicines, as well as a policy brief on medication safety and a systematic review on the global burden of medication-related harm. And we hope that the Global Patient Safety Challenge on Medication Without Harm provides a great platform for countries to prioritize medication safety and work towards reducing medication-related harm. As I mentioned about the Global Patient Safety Network, it's an interactive network which brings together all stakeholders, partners, countries, WHO country offices, regional offices together in real time in an interactive way to share the problems and challenges and also collectively find solutions. And currently it has more than 3,000 members and several organizations and ministries of health and partners representing 160 countries are currently members of the Global Patient Safety Network. So to summarize the global patient safety movement, the past, present, and future, we saw that the Patient Safety Foundation was created over a period of 15 years when for the first time, To Err is Human report was launched in 1999. That led to the very first resolution on patient safety in 2002, and also the first challenge on global patient safety challenge on clean care is safe care was launched. The second global patient safety challenge on safe surgery was launched during this time of foundation of patient safety. The time period from 2015 to 2018 was actually a rejuvenation phase when the political leaders and healthcare leaders initiated a series of annual ministerial summits, as I mentioned. And the very first Global Ministerial Summit on Patient Safety in London created the foundation for this rejuvenation and the second movement of patient safety globally. The second Ministerial Summit in Germany and the launch of WHO Third Challenge in 2017, and the third Ministerial Summit in Tokyo in 2018, and the launch of the Global Patient Safety Network, couple of important milestones in the rejuvenation phase. 2019, of course, was the watershed moment when the World Health Assembly adopted this resolution on global action for patient safety and also prioritized patient safety at a global level and established World Patient Safety Day. The fourth Ministerial Summit was organized in 2019 in Jeddah, and patient safety was also included under the G20 presidency of Kingdom of Saudi Arabia as an agenda item for G20. We are in the phase of implementing our vision, which we have created together through the Global Patient Safety Action Plan of 2021 to 2030, the WHO Flagship on a decade of patient safety, the annual theme of World Patient Safety Day, which is again prioritizing patient safety, the fifth and the sixth ministerial summits I mentioned, and also action related to working with countries as part of the Global Patient Safety Collaborative and the country cooperation and support. Thank you.